Okay, so today I'm going to do a demonstration for pediatric vital signs. So first, we need to verify the written order. Okay, and then after that, we need to make sure that we prepare all the materials needed. Okay, to ensure as well that the equipment to be used is intact and also functioning properly. So to start with, I am going to use this thermometer. It's a digital thermometer for measuring the temperature under the armpit. And then we have the cotton balls and the alcohol to clean the thermometer. We also have this BP tools. We have this stethoscope in here, and this blood pressure tool. And then one more thing though is before you proceed with the before you proceed with it, you need to make sure that you wear a mask. So I am going to use this surgical mask. Make sure that you hold both ends of it when wearing. Make sure it's fitted as well. Okay, so put it under the chin, and then make sure it's fitted on your, like, around your nose. So it's called your nose and mouth area, they're both covered. Okay, so then make sure that you know your patient, because if you're in a hospital, make sure to check the wrist tag. So it's important that you do your procedure to the right patient. Okay, so now we have here Ava. You introduce yourself to the patient. Ava is 4 years old. She's in the toddler bracket, and we are going to do the temperature check on her, pulse, and also the heart rate. Okay, so for the blood pressure, I am going to do it on an adult. So after, you need to wash your hands as well thoroughly, and make sure that you use Dawn gloves if you're doing an oral or rectal temperature. But since we're just doing the one for the armpit, we don't need to do that anymore. Okay, so okay, so we have all the equipment ready here. First, we're gonna do is the temperature. Okay, make sure as well that before you start that the child is at rest. I mean, if she's been playing or having activities around, make sure to give her like few minutes rest so that you can take the proper result. Okay, the correct result from your check. So for this, we're going to start with this. Make sure to clean it. Can you hold it, baby? Can you hold your iPad? Okay, so we clean it with a cotton ball and an alcohol. So there. So this is pretending that we've already washed our hands. Clean it from the stem to the bulb. So there you do it. Okay. And then after that, discard the cotton balls. Okay, and then since this is a digital thermometer, you turn it on, put it under the armpit of the child. Okay, so raise her arm, put the tip of or the bulb of it under, and then you just wait until it beeps. So wait for the so wait for the time, okay, until it's ready, and then after that you can record the result. Okay, so I have here the chart and a pen to where I would record the result of the temperature. Okay, so we just wait until it beeps. Also, it's important, or it's also best for you to let the child know what you're trying to do. Okay, so for her to be comfortable, and don't use like medical terminologies that a child wouldn't understand. But since my patient right now is busy, she's actually watching, won't be able to tell her that this one is for making sure that she's healthy and stuff like that, just in case you're talking to the child. Okay, so until it's ready. So now it's beeping. Now we take it out from her, and then we have the correct we have the right temperature. It's not too low, it's not too high. But if, for instance, that it's too low or too high, and you think that there's something wrong with the thermometer, we need to find another one to make sure that you're using a functional one. Okay, so we record it. Okay, so after recording that, get another piece of cotton balls and an alcohol, and make sure to clean your thermometer again by doing the same thing from the stem to the bulb. Okay, and then discard it. Okay, so after that, while you're trying to get her temperature, you can also get the respiratory rate as well. By doing so, you would have to observe the her shoulders dropping in and out, as well, or the chest. So you have to observe that for 1 minute. We need this watch with the second hand to do that. So we observe it and you count it for 1 minute. Okay, so try not to let the child know about it, because her breathing pattern might change. So you can also try and talk to the child while doing so, just so she's not aware of it. Also, it's applicable when you're doing it in an adult.
Are we done?
Not yet. Okay, so that's a minute. You have to record it. Okay, and then you can also check the heart rate by using the stethoscope. So we use a 9-pulse system for checking it. Can you hold it, baby? Can you hold this, Eva? So we do this by checking or counting the heartbeat for after me. Okay, it's your turn. After me, okay, just watch first. Count it for 1 full minute. Oh, that's nice.
It's Ryan.
Yeah,
How did you know?
I've watched it before.
Oh.
Okay, so need to make sure that in getting the heart rate, you check it or you count the heartbeat for about like 1 minute. Okay, so it should exactly be 1 minute. So there's
I want to do here now.
okay. So that's it, and also you make sure that your equipment is clean, just in case that the child wants to hold it or try it herself, because since we have a toddler here. Alright, so you have to record it. Okay, so now we were able to take the temperature of the baby or of our toddler here. We were also able to check the respiratory rate, and as well as the heart rate. For the blood pressure, I am going to do it in an adult. Thank you. Okay, so this time I am going to do a demonstration for taking the blood pressure. First, we need to make sure that the equipment is intact and they are functioning properly. So we have here our stethoscope, and then this cuff, the arm, the blood for taking the blood pressure. Okay, and then it's a must, or always remember to wash your hands thoroughly, or need to make sure that our hands are clean before performing this procedure. Also, an important thing to remember is that make sure that the client hasn't smoked or take caffeine 30 minutes prior to taking the measurement. So we have to position the client properly, okay, and then explain as well the procedure. Explain the procedure first, I mean, what we're gonna do. So my client here is Danielle, and I'm gonna explain to her, today we are going to take your blood pressure, okay, and then I'll make sure that the client is properly seated, legs not crossed, okay, and she's relaxed. So expose the upper arm, okay, if possible. So I'm gonna be using her upper arm for this, okay, and then make sure that the arm is at heart level, okay. So this is the proper way. And then we need to locate, or wrap first. We have to wrap the cuff, okay, evenly around the upper left arm of the patient. So make sure that it's not too tight nor too loose, just the right, okay. So there, we need to put it, okay, on the upper left arm of the patient. There you go. And then locate the brachial artery, okay. So this is because this is the artery where we are going to be listening to get our blood pressure, okay, because we're going to be getting the systolic number, which is the top number, and this is also the first sound that we hear, and also the diastolic number, which is the bottom number, and this is the point where we no longer hear the sound, okay. So brachial artery is found in the bend of the arm, so just this one. We use our index finger and the middle finger to feel it. So it's usually above here, okay. So we put the cuff 2 inches just above the bend. So this is where it is, okay. So now, if this is the patient's initial examination, we want to estimate the systolic pressure. So by doing that, we need to find, we need to palpate the brachial artery, which is this one. So we're currently feeling the brachial artery here. So we need to inflate, okay. So I'm just going to put the gauge in here so it's easier for me to see. Okay. So this is your gauge. Okay, you need to make sure that there is no air in this cuff. Okay, and that this is closed by turning it clockwise. So close the valve, and then feel this, the brachial artery here, and then we have to inflate the cuff until we no longer hear the brachial, we no longer feel the brachial artery here, okay? So look at the gauge to know the number, because that number, this is the gauge, because that number is the estimated systolic pressure of the patient. And then after that, slowly release the valve. and then deflate the cuff so there's no more air in it. So now we're able to determine the estimated systolic pressure of the patient. We now use our stethoscope to listen for the blood pressure. So take your wear your stethoscope, and then this is the bell side of the stethoscope. We would use this to measure the, or to hear, okay, the beat. Okay, so we put here on the brachial artery. All right, make sure it's not too much pressed. Okay, and then your other hand, use it for pumping the calf. So, okay, make sure that there's no more air in the calf, and then close the valve again. Okay, and then you start pumping up until it reaches 30 mmHg above the point, okay, above the point where the brachial pressure, above the brachial pulse disappeared. And then after that, release the valve. Okay, so release the valve on the cuff to decrease the pressure. So as the pressure falls, you start taking note of the systolic, which is the first sound you hear, and the diastolic, which is the bottom number, and that would be the, okay, where you no longer hear any sound. Okay, and then after that, deflate the cuff completely. And then you should be able to take note of the result. So take it off completely and quickly, as much as possible, from the patient's arm. Alright, and then try and arrange your materials, and then wash hands also after doing the procedure, and then you can now take down the result. Also, you can inform the patient what the result is. So that's about it. That would be my blood pressure demonstration for today. Thank you.